Hi everyone, let's talk about stem cell treatment. I have patients that are interested in stem cell treatment. In fact, some of the orthopedic community around here in Naples, Florida have actually embraced stem cells after we started using them on our patients. So what are stem cells and what are if there are any ethical considerations of this? That's one of the first questions I get asked from patients. Well, the ethical considerations are when you hear about people using stem cells from aborted babies or from embryos, that's the ethical question. But that's not what we're using. We're using amniotic stem cells from the amniotic fluid as well as the amniotic membrane of healthy born babies. So the amniotic sac, of course, is discarded anyway, and the amniotic fluid is also discarded. So the tissue bank has these donors that are pre-screened, and then after the pre-screened, if they pass the test, then the FDA-approved laboratory will obtain the amniotic fluid as well as the amniotic membrane, and will take out the section amniotic membrane that are good for transplantation. We use the amniotic membrane itself for tendon repair, nerve repair, as well as all kinds of soft tissue repair and barriers when we're in surgery. The amniotic fluid as well as the amniotic cells that are alive are harvested, and we use them for joint rejuvenation as well as for tendon repair. Also, wound care has also been very effective with this amniotic stem cell, because what are they? They're pluripotent, means they can differentiate into different cells. So this one stem cell can differentiate into tendon, joint fluid, cartilage, etc. In the correct environment with the correct signal. So this upcoming cases talks about a lady that is a health and wellness coach as well as a naturopathic physician herself. She requested stem cell treatment for her first toe joint pain and stiffness. She's been having this pain for about 15 years, and in about 2 weeks I'm able to take away that pain. Take that back. In about 48 hours, the pain was gone, but I see her back in 2 weeks for follow-up. So the following is her video. Stem cell injection for the first toe joint arthritis. Osteochondroma, actually. She has a little benign bone tumor here. That's asymptomatic. But right here, she has an arthritic joint. She has a nice bone spur on top here. Came in, we gave the stem cell injection, and how long did it take for the pain to go away?
48 hours. Now 2 weeks later, it feels like a new foot. No pain, I can't even feel it. It's a miracle.
Well, let's say prior to this, what were you feeling?
Oh, pain for about 15 years.
Pain in the joint for about 15 years?
Getting worse each year.
Mm-hmm. Okay. Getting worse each year. So 2 weeks ago, we gave you the stem cell injection right into here, the amniotic stem cell, about 1 cc, that's what I gave, right into the joint under ultrasound. And today, actually, it feels pretty smooth.
It's amazing. It just feels like my toe did when I was 28 instead of I'm almost 60 now. And I couldn't even get to the point where it's hurting me to exercise. Now I can do anything on it. It's just totally a miracle for me.
Great. So you recommend this to other people who
have
absolutely. Arthritic joints in the foot or the ankle?
Yes, I've already told many of my clients to come here. I'm a wellness coach, and I've already got them coming here to do the same procedure.
Well, this is great for wellness because we're not doing steroid, we're not breaking you down, we're actually rejuvenating the joint for you, giving you another option.
And putting off the prevention of maybe not needing surgery down the road.
Correct.
So also the joint's not going to age as fast.
It definitely won't age as fast. It's actually reversing some of the aging for you.
I'm so excited.
Well, great. I'm glad you're doing very well. Thank you.
Thank you.
Great.